Good morning, good afternoon, good evening. Live from Toronto, this is IFA's Global Café. My name is Bruna Swerts, Director of Strategy and Communications at IFA, and it is my pleasure to host today's session. We have our very own Mr. Greg Shaw moderating today's session, advocating for the rights of older adults in low to mid-income countries. We have Mr. Vijay Naraidoo as our guest speaker. And just in terms of housekeeping guidelines, this session is being recorded. We're streaming it live on Facebook through our channel. And if you have any questions, please make sure to use the chat function below your screen. Thank you. Greg, the floor is yours.
Good morning, good afternoon, and good evening, and welcome to our series of Global Cafes. Today, we're listening to a really passionate speaker advocating for the rights of older adults in low and middle income countries. Vijay Naraidoo is a founding member of the Mauritian NGO Jumoy, Human Rights Indian Ocean, which was founded in 2012. Vijay has been an educator, public relations officer, Secretary General of the Mauritius National Commission for UNESCO under the aegis of the Ministry of Education. He's also occupied positions of advisor on information matters and trainer in performance and management systems. He holds a postgraduate diploma in planning, management, evaluation of rural development projects from Pan-African Institute for Development in Zambia, and he is currently Chief Operations Officer of the National Housing Development Company under the aegis of the Ministry of Housing and Land Use Planning. He participates regularly in TV and radio programs and writes extensively on the rights of older persons. As a co-vice chair of GARIP and an SG member of IMPEA and SGA Africa, Vijay is called upon by national organisations to offer training in human rights, to host audiences, including students, young adults, and professionals working with older persons. Vijay, we really look forward to hearing from you today. And as Bruna had mentioned, please, if you have any questions as he's going through his presentation and talk, please post them in the chat function, and I will then moderate question and answer session following Vijay's presentation. Vijay, the floor is yours, sir.
Thank you. Greetings from Mauritius. Greetings from the South Indian Ocean region. I feel very comfortable and familiar among my fellow advocates like Moira, Margaret, Cynthia, and many amongst you whom have come across virtually. Today, my mission is to talk about advocating for the rights of older adults in low and middle income countries. I'm going to start by referring to what I know, what has taken place, what we have been doing in Mauritius and in the islands of the Indian Ocean region, which have, different levels of economic achievement. Now, Mauritius has been considered, for quite some time as an upper middle income economy. But as everybody knows around the world, countries have been impacted by the COVID, which has created, a lot of difficulties, socio-economic difficulties. And those, at the lower rung of the ladder have suffered the most. Fortunately, the state, the civil society, have taken up arms in order to show resilience and come to, to the help of people who are directly impacted, in terms of food, in terms of access to services like health. Now, Mauritius is a neighbor to the following islands. Within the Republic of Mauritius, we have Rodrigue, we have Agalega, and the Chagos archipelago. And then we have Madagascar, which is a republic, at the northeast of the country. we've got Comoros further north, the Seychelles just near there, northeast, and the Réunion Island, which is our neighbor, and which is, I wouldn't say a French colony, but a French territory and under the control of the French government. It is a French country. Now, in respect of our mission and vision, that is of DIMOI. DIMOI stands for Droits Humains Océan Indien, human rights in the Indian Ocean. Our ambition was not to limit our actions and campaign advocacy within, the geographical setup of the country. We have put in our mission to outreach the countries that I have mentioned just now. And we want to develop in this region a culture of human rights, a culture of peace, a culture where, people have the respect of the other in respect of human rights. Now, what we have done at first, in order to create an identity for ourselves, we have registered with the Registrar of Associations. Very important to have the legal personality, to have a legal entity, to have a legal status, which gives credit to what you are going to do. And we have made it that our accounts are verifiable. We always speak with evidence-based approach. Now, we have sought and obtained affiliation and representation, at the highest level. I'll tell you how. We are now a member of the Mauritius Council of Social Service, which is an apex organization of NGOs in the country. And that apex NGO is in itself an emanation, of the legislation of the country. Then we have, through lobbying, become a member of the National Mechanism for Reporting and Follow-up of Human Rights. And this mechanism is presided by the Minister of Foreign Affairs. And this has been a decision of the Prime Minister's office to put in the NMRF in the country. We meet every month. We review progress. We review challenges in each of our sector. And it stands to reason that myself being the representative of DIMOI, I put on the agenda, excuse me for that expression, I made it a point to put it on the agenda that we have that question of the rights of older persons, rights of older adults. And in view of the convention to be, I'll come to that convention later, and the AU protocol, the UN convention and the AU protocol for the rights of older persons. Now, what we have done further, besides our official status, besides gaining a position in these institutions, what we have done, we have made ourselves known to stakeholders in the country because we are humble. We say to ourselves, we do not have the monopoly for the defense of older persons or the monopoly for the defense of human rights. We need to work with other actors, with other stakeholders, because they are here, they can contribute to produce the one voice. I'll tell you how. We have been outreaching the Senior Citizens Council. Again, the Senior Citizens Council has been put up by the legislation by the government of the country of Mauritius, and it has got an official status. So it groups almost 1,000 senior citizens associations across the country. Now, we have moved towards the Women's Association. These two operate under the aegis of the Ministry of Gender and Protection of Women and Children. We have enrobed the participation of community development associations. They are in the regions, they are in the rural areas, they are in the urban areas, they are close to the grassroots. So when we collaborate with them, when we seek the collaboration, what we are doing, we are outreaching the greater number. Now, we have trade unions, the associations of workers. They are very important. They are a very important segment of the social fabric. Why? Because they defend the rights of workers, whether it be in the civil service, whether it be in the private sector, whether it be in the tertiary sector or in the primary sector. When you defend the rights of workers, you are defending the rights of people. And by extension, you are defending the rights of older persons because these workers, they have got their older adults at home. So the message is being sent across, across generation from bottom up. Now we have gone to the tertiary institutions. This is the intelligentsia. This is the academia. We have to meet with these people. We have to tell them that the rights of older people have to be respected. Earlier, I was telling, great, because at my age itself, it is a proof that you can hold important responsibilities. It is possible. And this is how we defeat that campaign of ageism. This is how we prove that ageist attitude has to be defeated, has to be addressed. Now, when we talk with the tertiary institutions, we go to the universities. We do exhibitions at the entrance of the university for the students. We have been training the administrative section. Now, secondary schools, sometimes people say, you are going to talk about the rights of older persons with younger people. So the answer is yes, because we have to train the younger generation to have not to do with the older people what would not people do to you when you become old. So right from now, we're not talking about the rights of younger people, but about the responsibility of the younger people. So when you talk to them about rights, and they are going to have a different attitude towards their older parents. Let me tell you, everything is not rosy in our society. We have got crimes against older people. We have got, attacks on the older people. We are a society like many other societies. Therefore, we have set ourselves the task of, training all younger people, younger adults, the older people themselves, and whether they are women in the associations, mixed communities, whatever they are. And now we have also, developed an MOU, a memorandum of understanding with the police force. We train the police academy new recruits. So if they recruit 500 new agents, new police agents, we go around the barracks. We go there and we train police to have a different attitude towards society, towards people, and towards the older people. Now, what we have done in parallel, we have constructed an online training in human rights with 6 modules, one of which is the rights of older persons. So we have our own training center. We go outside outreaching the people in their communities, in the environment, but at the same time, people have the means to follow our online courses on human rights. Now, these courses have been offered to human rights advocates in the Comoro, in Madagascar, in Seychelles, in Réunion Island, in Agalega, in Rodrigue Islands. These online courses have been consolidated by on-the-spot workshops. To take an example, excuse me if I'm going to mention myself, following the online training with people in the Comoro, with younger people, advocates, I have myself traveled to the Comoro in order to run workshops and consolidate what they have been learning online. Now, the impact of these courses online and on the spot has been that these advocates, together with ourselves, we have put in 10 mois, droits humains entities in each of these islands. They are not all moving at the same pace. I can tell you, Rodrigue, Agalega, Madagascar, Reunion Island are moving very fast in terms of advocacy, engagement, commitment in human rights. Now, what we have done, not only putting up a DMOA entity in these islands, but we have stressed on the fact that we need to have a commission, specialized commission for the rights of older persons. So to say, we have created a kind of a we call that a chain, a coalition of commission for the rights of older persons in these islands, and we connect, we meet virtually, and then we have, in parallel activities in Reunion Island, in Madagascar, for example. They are doing what we are doing. We consult. We have consultative meetings. Now, concurrently, what do we use as methodology? It's talks, using PowerPoints, using flyers, using posters, and organizing. Annually, we organize walks, march in the streets of the country, 1 year in the urban area, another year in the rural area. Once in Mauritius, another time in Rodrigue, and our colleagues in Madagascar are doing the same. What we do that on the International Day of Older Persons, with our posters, with our banners, to attract the attention of a greater number. Now, have been going to all the radio stations in the country, all the radio stations, and they have got their TV. The radios have got their own TV channels, which means that over and above the hearing audience, we have got people watching the same interview that we, in which we are involved in the radio stations. And then we have got the national TV. So much so that the TV now invites us on, important days of human rights, International Day of Older Persons, on the World Elderly Abuse Awareness Day, for example, United Nations Day. We get, so much so that we get the cooperation, the collaboration of the UNDP in Mauritius, United Nations Development Program. Now, I would say in French, le gâteau, la cerise sur le gâteau, that is what we do, also publish. Since 2 years now, we have obtained 2 dedicated pages in the best sold newspaper daily in Mauritius, 2 dedicated pages weekly on human rights. We publish our own articles on human rights. 1 week we have an interview and a specialized article on the rights of younger, let's say, of women, of people with disabilities. But regularly, in turn, we have articles on the rights of older persons, the campaign that we are doing, and why is it that we are doing that campaign. It's not only to take conscience of our rights, but we are telling that older people have got their place in our society. Now, what do we tell? What is the content of our message? The content of our lectures, the content of our talks. We talk about the Republic. We have to understand the meaning of the Republic. What is the Republic? What is it about? The Republic, we talk about the Second World War. What happened before the Second World War, the First World War, the Second World War. What happened? Millions of people have been killed. The emergence of the United Nations. Now, year after year, we have made submissions on the theme proposed by the United Nations. We have participated virtually from home in the discussions. We have lobbied with the Ministry of Social Security, which is the parent ministry of older people. We have lobbied with that ministry to convince them to give instructions to the Ministry of Foreign Affairs, very important. And the Ministry of Foreign Affairs has given instructions to a mission in New York to participate actively, to take a strong position in favor of the convention. I am happy to tell you that this has been done, and year after year since, we have maintained that position. In parallel, we have been campaigning for the state of Mauritius because we are a member, an active member of the AU, African Union, to sign the protocol for the rights of older persons in Africa. And this had been done last year, in May last year. Government of Mauritius has signed the call, and now we are not going to rest on our laurels. We are going to campaign again for Mauritius to ratify that protocol, the same way that it is going to sign the convention when it comes and ratify it. So we explain all these process and procedures. We tell them this includes how the government will bring it to Mauritius, will domesticate it and legislate in favor of the convention protocol. This is education. This is training. We have to, in French call that vulgariser, to make it simple for the people to know this. And I can tell you, when we go to talk to the field workers, to the laborers, to the people in the countryside, we talk about this in the language that they understand best. Now, to make things happen, as I told you earlier, we do not have the monopoly. We're not alone. We have got our stakeholders. For the past 3 years, we have been conducting, running national multi-stakeholders meetings. To these meetings, we invite NGOs in the sector. We invite the representatives of the Ministry of Foreign Affairs. We invite the Minister of Foreign Affairs himself. We invite the National Human Rights Commission, representatives of the Ministry of Social Security, of Gender. So they have to come with us. We discuss around the table. We discuss around the themes around the convention. Why a convention? And finally, as one person, as one voice, we go towards that ministry, as I said, and then that message will go to our mission in New York. Now, as I said, we intervene systematically on the International Day of Older Persons, UN Day, World Elder Abuse Awareness Day. We tell the people, rights are indivisible. Older people have got the same rights of choice, rights to life, rights of opinion, of shelter, food, lodging, clothing. Young people have the rights, but they have the responsibility. Older people have the right to work, and we do not lose our rights with age. Now, GIMOA, as I told you, has made submissions. We have been participating in the open-ended working group on aging for the convention. We have roped in the islands of Madagascar, Réunion, Seychelles, Comoros. The word has been spread. We are not going to sit saying that we are satisfied. The struggle goes on. We have to continue campaigning to keep live, to keep the fire burning, as we say amongst ourselves, amongst the advocates. I do not know, Bruna, whether I've managed my time, but I'm open for questions, and I'll be most pleased to answer questions that our good colleagues would have for me. Thank you very much.
Vijay, thank you very much for that presentation. There is no doubt that you and your organisation is doing a lot to try and promote the rights of older people in Mauritius and the region, and I commend you for the work that you're doing. So I know Mauritius would have been impacted by the COVID-19 pandemic, and Shmuel from Israel has asked the question, has the pandemic created barriers for you and your work in advocating for the rights of older people, or has it created opportunities for you during the pandemic?
Yes, as a matter of fact, older people have been impacted. Like everybody during the lockdown, older people could not go out. And those who were living alone were more at risk. So what was done? The government had a mobile, mobile car, a car, police accompanying, going from home to visit the older persons who were living alone, to deliver food pack. And ourselves and other NGOs, we accompanied, we did the same wherever we were active. So older people were not left without food. At the same time, they could telephone the health services to have an urgent ambulance coming to the home if ever they had any issue with their health. So truly, older people were impacted, yes, because they couldn't go out to buy food. They couldn't go out they couldn't go out and meet people. So what we did, we advised them to stay inside, to walk inside the premises in order to have, a minimum of physical exercises and to keep safe. But at the time they had to touch, to go and collect their pension, they were accompanied by the police to the bank. And at some time, the officer of the Social Security came to their home and delivered their old age pension from home to home. This was what was done with regards to older persons during the lockdown.
Thank you, Vijay. I just sent you the second question. You can see it on the chat. This is coming from Mrs. Danielle Goodman. That should be the final message that I sent to you. In advocating for elders, what do you see as key constituencies to enlist other than elders themselves?
Well, apart from older people themselves, the constituents would be, as I mentioned, the organizations that we have, civil society, in terms of associations, of older people themselves, trade unions, fellow NGOs. I'll mention one example. The Federation of the International Associations of Older Persons, doctors, nurses, teachers, whether they are individuals or groups, organized groups. We have the management of the secondary schools. So we cannot operate as an island, we cannot operate alone. We need to develop a kind of MOU. With some people, it is a written MOU. With others, it's just, going towards them, negotiate, agree, and we develop a program. So this is how we work with our constituents.
There is no doubt that your organization really reaches out across sectors, particularly in your region. I have very fond memories of the time that I spent in Mauritius and understanding how the Mauritius government is supporting older people to the best of their ability. I know Margaret Gillis has raised a comment for you, and it was that you've been very successful in advocating. And you're an active member of GARA. can you tell
Yeah.
us how your activism has benefited from Garup, whether it's being a member of Garup has been beneficial for you, and conversely, how you've been able to contribute to Garup?
Good. You know, when even before I postulated or I stood as candidate to become a member of the steering committee of Garup. Even before that, we had developed smart, strict relations with HelpAge and eventually with Garup. Now, whenever I've had the opportunity of sharing with my colleagues in Garup what we are doing in Mauritius, I've done so. I've shared that. And then when it came to take decisions, like about participation at the open-ended working group on aging, our participation at the NGO committee on aging, whenever we had to discuss about that, to take a decisions, up to now we have worked by consensus. We have discussed, we have seen the advantages that we have to be in the mainstream. So I think directly or indirectly, I have contributed to keep not myself, not alone, with my colleagues, Garup in the mainstream for militating, for advocating for a convention. Now, what I have obtained myself, not myself, but my organization, and by extension, Mauritius has obtained from Garup. We have conducted survey, studies in the country. 500 men, 500 women, on old age, how they feel about old age, how they are victims of ageism, what about the independence, what about the freedom. We have done this, and this has helped us to know the situation in the country. Further, Garup used to send us a template letter. This template has been instrumental when we have used that template to write to the authorities in the country, write to government. This template was so strong, forceful, and plenty of wisdom that I know that this template has pushed the authorities to believe in what we are doing. So in summary, it has been a two-way traffic. We have learned from Garup, we're still learning from Garup. And I hope humbly that I am sharing, what from my experience, what I'm doing with my colleagues in Garup.
Thank you very much, Vijay. That's
thank you.
Very helpful. I've got a quick question for you, and it's really my reflections of the time that I was in Mauritius. It was now 12 years ago, and at that time, the government had a free public transport system, particularly in the main capital, for older people outside of the key hours early in the morning. Do they still have a free public transport system for older people?
Okay, so you give me the opportunity to enlarge my presentation in terms of policy towards older people. Good to know that in Mauritius there is universal old age pension since 1952, even before Mauritius became an independent country from Britain. We got independence in 1968, but even then, at that time, the local government, which was not, so to say, a kind of full-fledged government, it was a government, governed by Britain. So we had universal old age pension right from 1952 up to now, and this pension is increased, regularly, taking into consideration the rise of the standard of living. Yes, we have a public transport, free public transport for older people right from the age of 60. And now the country, we are introducing the light rail already in operations along certain lines, and it is being extended. The works are going on. Even here, for the light rails, older people are traveling with a ticket or traveling freely. I want to add something. You know, when we reach the age of 60, automatically we are qualified to have that old age pension. But officially, we retire at the age of 65. At which time we are going to have our lump sum and our pension based on our contribution for a pension in our system. You know what? We obtain the old age pension right from 60 and beyond 65, double pension and the lump sum. So, you know, in terms of welfare state, I can tell you all the people are well treated. Health services are free. We have, you know, an advanced type of,
Well, hopefully we'll get Vijay back shortly. But back in 12 years ago when I was there and recognizing the great free public transport system that you had, particularly in the main capital, what some of the elders were telling me was that if they were alone at a bus stop, sometimes the bus would not stop for them because they realized that they're a free passenger, whereas at the next stop there's a paying passenger, particularly when the public transport system was fairly full. So to a degree, bus drivers themselves were discriminating against older people based on the knowledge that they weren't going to receive as much money for that bus trip. Is that still the case?
So what you are saying is true. It's true. Yes. And one of the points in our campaign has been this. In my PowerPoint, I show the bus which doesn't stop at the bus stop, and I show all the people waiting patiently, painfully at the bus stop for more than 1 hour. Yeah. Now, these bus companies, they are paid every month compensation to carry all the people freely. So there was an education to make, you know, with the private bus owners. We have got a national bus company, which is a national transport company, which gives satisfactory service. But the private owners, as you rightly said, were doing this bad practice. Right. So we have been campaigning, is conscientizing, calling the authorities to take measures and to threaten these companies not to give them the compensation that they deserve, because they don't deserve it actually. But this has changed. I can tell you it has changed, but I still have to verify. We haven't obtained for the past 6 months or 1 year some representations from all the people at our office. We haven't, and I haven't seen heard any complaint on the radio. But I can tell you, whenever we have this complaint, we intervene. When I say we, it's not only Dimwa, it's the ministry, it's the people in the offices, it's other NGOs too. We are vigilant with regards to this ill treatment of older people. Thank you very much for raising this question.
Thank you, Vijay. And I suppose my comment was really in that what you might see as a very good initiative in some respects can be a disadvantage to some older people, particularly around the private bus companies. So keep up the good work and trying to advocate for those bus companies to do a better job. I've got a couple of other questions. Nesta wanted to know what role of the social media has in your advocacy work, and are you able to share some examples of your work around ageism in advocacy?
Absolutely. Thank you. Now, the social media, apart from the mainstream newspapers, you know, radio stations, we animate our own Facebook pages, which is not so I mean, which needs to be improved, which needs more engagement from our colleagues at office. Then our own website, you know, we need resources. Our own website, we have time and again asked some professionals to come and help us to modernize it, to update it, which is not an easy task to do. I have to be frank with you. We have got a lot of resources in the country, resources in terms of people, in terms of human minds, in terms of even money. But this is not always easy to invest in that. I have to be frank with you. But then we do not give up. We do not give up. What we are doing is, as I said earlier, using our newspapers, using our face-to-face, you know, going around. Let me tell you, we spend most of our weekends, afternoons, even during the day, outreaching people, going out, because, you know, we are not, you know, our center physically shouldn't be the center of our advocacy. We have to move out, go out, see people. I don't know whether I have answered your question.
Yep. No, you have, Vijay. So thank you very much. Naomi D'Souza from Toronto has been asked a question around medical assistance in dying, particularly for the old. Is there policies in Mauritius around medical assistance in dying, or is that something that isn't taking place in Mauritius?
Yeah, what happens? An elderly, an older person who falls ill is brought to hospital for treatment. That could be long-term treatment, that could be short-term treatment. It is possible for the family, sometimes they are encouraged or, you know, to take that elder person who is sick home, because this is where that person who is in great difficulty, who is, let's say, allow me this word, dying, is brought home. This is where he or she feels more comfortable to be amongst the closer ones and assisted by a carer trained for that purpose, paid by government for that purpose, supported by medical officers who would come regularly to the house.
Yeah.
Now, in terms of specialized treatment for older people, we have a unit in each hospital, but the government is coming with a specialized hospital for older people. This is in the program of government. At the moment,
Vijay, the question really is, in terms of someone with a very chronic condition that can't be managed, and they have a wish that they want to die. Is there a policy in which allows that in Mauritius?
No. So clearly now I get the question. No, we don't have a policy of encouraging somebody to put an end to his or her life. No, we don't have this. No.
All right. Thank you. That certainly answers that question.
Okay. I'm sorry I couldn't get the question earlier properly.
And thank you, Naomi, for asking that question. I know we're only a few minutes away from finishing, and I want to thank you, Vijay, for the examples of the work that you're doing, the passion, the commitment that you have to advocate for the rights of older people in your region and in your country. I would certainly encourage anyone that's on this call today. Mauritius is a fantastic place to go and visit, and please look up Vijay if you actually go there. Vijay, I'm going to ask you to give a few closing comments about what you want people to know and take away from this global cafe. But I also want to mention before I do that, is our next week's session, which is August the 26th. And Amber Kolibaiba, who is the coordinator of Rural Aging Research Program at Trent Centre for Aging and Society in Ontario, Canada, will be talking to us about combating ageism through education and intergenerational activities. I certainly encourage all of you on the call today to actually sign up for that presentation. I'm sure that Amber will give a stellar performance and raise many questions from the audience. So I really look forward to Amber giving her presentation next week. With that, I'm going to you, Vijay. What are your closing comments and closing thoughts?
Okay. You know what? My audience today, I presume, is of my generation. And I do not consider myself as old. It's a question of age, it's a question of years. We all belong to humanity. We have all embarked on a mission. All of us here, my audience, people have been asking questions. We have embarked ourselves on a mission. And that mission is to create conditions for older people to live their life until such time that they pass away in harmony with nature, in respect of, their opinion, well-being, welfare. This is what is the convention going to bring? Respect, dignity, self-esteem is what we are looking for. Same for the protocol. So myself, I have put it on me that this is our mission. The vision is now a world where the rights of human beings are respected. So I think we are in unison. We have a shared understanding of the rights of all the people. We know where we are going. So we have to put in our energy. We have to bring people around us to strengthen our team wherever we are, in the country that we are, in the village that we are, whether it is a large country, it is a highly developed country, or a low-income country, we have the same message. But then the challenge is greater, not only in the low-income countries, but even in the highly developed countries, because the rights of older persons may not be respected. The rights of older persons should be respected, should be part of our environment, of our ecosystem. This is the message that I want to convey today.
Vijay, thank you very much for that important session and your work. I suppose my closing comments would be clearly the work of the government of Mauritius at the UN and their support for a new instrument on convention protecting the rights of older people. I suppose what I'd be trying to encourage you to do is encourage your government and those representatives to speak to those missions and other governments in the region to basically come on board and say, yes, if there's a convention, we will adopt and sign or ratify such a convention. I hope you can push your government to make much more of an impact across the region with those other countries.
Thanks go to everybody.
All right. Thank you, Vijay. And with that, I will say goodbye, good evening, good morning. And until next week, look forward to seeing you then.